I didn't want to be out of work for 2 recoveries. I was pretty sure I needed both my hips replaced, that I was a veterinarian and had some working knowledge of the systems. I was in a great deal of pain. I work long hours here at the office. I'm on my feet for the majority of the time and need to be able to move quickly to manage both emergencies and just accommodate the movement of animals and the occasional snappy dog that we have that we need to get out of the way of. And it was becoming more and more difficult to do that.
Paige was a unique professional individual who was young, active, has a very demanding job as a veterinary surgeon. I think it's important to evaluate all the different characteristics of patients to try and find a treatment, which is not always surgical, to find the best treatment for them.
I wasn't particularly apprehensive about the surgery. I knew that Dr. Jenkins was very meticulous and very thorough, and I knew it had to be done.
I discussed with her a surgery of both of her hips, both hip replacements under the same anesthesia. I only offer that to patients who are young enough and healthy enough to tolerate the surgery, and patients that would desire one single recovery, understanding that that recovery would be a little bit more difficult.
Dr. Jenkins and I were able to make a plan together. I felt like he was very thorough in his explanations of what he was doing and why he was doing it.
I try to do everything with the most attention to detail in a way such that patients have an earlier recovery, do better faster, and have the longest duration of service of their implants. I'll operate on one hip, the hip that bothers the patient the most, and then we'll have 2 sets of instruments in the operating room. We'll have one set for the first hip, we'll do the surgery, and then we will prepare and drape the other hip and then use the new set of instrumentation for the other hip, while the patient's still in the same position in the room on the same table on their back. During the surgery, I use fluoroscopy, which ensures that all of the implants are placed in the best orientation that we can. I see in real time quality control of the implants that I'm placing are placed in a way that is acceptable and optimal for their anatomy.
The care at Miriam Hospital was excellent. The nurses, the physical therapist, everybody worked well with me. I found that the whole process was handled very well.
No pain there, huh?
Nope.
She progressed very quickly, and she's still enjoying a very high level of function and pain relief. She really did quite well with physical therapy and really surpassed all expectations.
So 7 months post-op, I'm doing great. I'm able to work all day, be on my feet for my patients. I'm also able to walk the trails. I've started running a little bit. I've been out dancing, which I wasn't able to do prior to the surgery. There isn't anything that I can't do now. My hips no longer limit my life. And in fact, it's just been life-changing. It has changed everything about my life compared to the last 5 years.